put a scare into me for a minute there. My name is Allan Ramsey. I have been a family physician in Vermont for 38 years. I was an original member of the Green Mountain Care Board and served for 5 years. I live in Essex Junction, Vermont. I'm currently the medical director of the People's Health and Wellness Clinic in Barre, Vermont. My patients at the People's Clinic are either uninsured or underinsured. Many have diabetes, heart disease, or chronic lung disease, and some cannot afford their medications. They have medical problems that have gone undiagnosed and unmanaged, and even cancers that could have been diagnosed at an earlier stage. This is all due to lack of insurance or access to basic health services. Now, with the gradual dismantling of the Affordable Care Act, we expect the demand for our services to rise dramatically. Without the insurance mandate or cost-sharing reductions, fewer Vermonters will enroll in Vermont Health Connect, and the re-enrollment process for Medicaid may quickly lead to a reduction in access to this coverage. Prior to the Affordable Care Act, low-income Vermonters had a safety net, namely the Vermont Health Access Program or the Catamount Plan. We cannot resurrect those overnight. I fear more Vermonters will simply fall through the cracks and more will suffer, just as we have heard tonight. When I accepted Governor Shumlin's offer to join the Green Mountain Care Board in 2011, I knew I would be giving up the career I loved as an educator and a family physician for the people of Colchester and Milton. I did so because I believed in the basic principles of Act 48. I believe we have a moral responsibility to provide health care to all Vermonters. I knew that if we changed how we delivered health care services, and maybe how we paid for them, all Vermonters could be covered in a high-quality system that would reduce the growth in costs. I still believe that is true, and Act 48 should be the foundation for health care reform in Vermont. To that end, we have an opportunity to take the first steps towards fulfilling the promise of Act 48. A universal primary care program for all Vermonters would be just that step. Passage of this bill would mean all Vermonters had access to primary care services, regardless of their insurance status. There would be no copays or deductibles, allowing Vermonters to access the preventive health services without fear of the cost. If other problems were identified, they would still have their major medical coverage by commercial insurance, Medicare, or Medicaid. Others would still have the clinics for the uninsured until we enact the full promise of Act 48. The simple and logical truth is that we do not expect our car insurance to pay for the gas we need to run it. We should not have to rely on insurance to provide the primary care that we all need to stay healthy. You will be debating many things during this legislative session, but there are only two things that impact all Vermonters: taxes and health care. It is time for you all to take a leadership role. We have not heard from the Scott administration any meaningful approaches to increasing health care access for Vermonters. We are all depending on you, as we have heard tonight. Thank you.